Welcome to Firebird's International Student Orientation presentation. Today, we will discuss your student health plan and how to use it. What is health insurance and why do you need it? In the United States, our health care is not provided by our government. Therefore, health insurance was designed to cover the costs of medical expenses from a doctor or hospital. Without health insurance, paying for your own medical bills can be very expensive. You may receive this insurance ID card brochure in your packet. If you do not, you may receive instructions from your school on how to access and download this from the Firebird website. This brochure contains all the information you need to access information about the plan, such as the insurance booklet, claim forms, as well as how to contact us via phone or email. Please know that we are available to you 24 hours a day, 7 days a week. If you lose your insurance ID card, you can download another one from our website. It is very important that you keep this card with you at all times in the event you need medical care. Our contact information is on the card, and we provide you a section to write your name and student ID number that was assigned to you by your school. Your student ID number is also your medical ID number. Please be sure to write it clearly. What should you do if you get sick? In the US, our doctors are not all in a hospital. If you have a minor problem such as a backache, a headache, a cough, or a stomach ache, we encourage you to call and make an appointment to see a doctor at their office or clinic. If you do want to be seen on the same day and your condition is not an emergency, you can go to an urgent care clinic, which is a walk-in facility, and you do not need an appointment. How do you find a doctor or hospital? Go to the Firebird website and on the home page on the top right, click on Find a Doctor. In this next screen, click open the drop-down and find your school's name and click on it. The next screen will give you two links. If you are in the states listed under the First Choice Health logo, click on the link next to that. You will be directed to the First Choice Health Dr. Find website. Right on their homepage, click on Find Care. Search boxes will appear below that. The first box will ask for the name of the doctor or hospital you are looking for if you know it. If you do not know this information, please leave that box blank. In the second box, it will ask for your location. The easiest thing to use is the zip code of where you are. The last box will ask for what kind of doctor you are looking for. As an example, we are using primary care provider, which is a general doctor. Then click on the search button. The next screen will be a welcome screen. Look for the drop-down and select Entire First Choice Health PPO Network, and then click on Continue. The next screen will give you the results of your search. The providers listed may be in alphabetical order by their last name or by the distance to the zip code you used. If you are not given any results, on the left side of that page, you will have the chance to refine your results. We suggest expanding your search to 5 miles or more. In this same section, you can also adjust the date of your visit, as well as search for a doctor that speaks your language. If you prefer that your doctor is a man or a woman, you can also narrow your search with this feature. On the same day of your visit, please be sure to have your insurance ID card with you. On the card, you will see a turquoise bar that lists an office visit copay of $20. This is the amount you have to pay each time you visit a doctor or urgent care clinic, so please be prepared to pay this at the time of your visit. What do you do if you are hurt or if you have been in an accident? If you cut yourself and you cannot stop the bleeding, or if you fell down and you're not sure if you have sprained or broken a bone, this is when you will need to go to the emergency room at the hospital. The reason we encourage you to make an appointment or go to an urgent care for a minor problem is because your copay at the hospital is $100, and that's per visit. If you were in a bad car accident, or if you are having a hard time breathing, you can call 911. This is the universal phone number in the US that you can call from anywhere on any phone if you have an emergency. An ambulance will be sent to your location and they will bring you to the nearest hospital. As a reminder, your copay for the emergency room and hospital is $100. Please be sure to have your insurance ID card with you, as the hospital may ask you for this so they can properly send their charges to the insurance company. Who pays your bills? On the back of your insurance ID card, you will see this company's name with their address. This is who doctors and hospitals will send their bills to. How do you know when your bills have been paid? When the insurance company has processed the bills they receive, they will send you a statement like this, which is called an explanation of benefits. As it says, this is not a bill. You will not receive any bills from the insurance company. If you have any questions about this document, our phone number will also be on it, so please feel free to call us if you don't understand anything. If you do receive any bills in the mail from any medical provider, please do not make any payments. Instead, please take clear photos of the bills and email them to us at our email address on the insurance card, and include your full name, school name, and student ID number. The next thing I want to talk to you about are general policy exclusions, which are medical expenses that are not covered under the policy. I won't list them all, however, the full list is in the insurance booklet, which you can access on our website. I will let you know about the most common ones we get asked about. The first one is about eye exams. If you get a routine exam of your eyes to check your vision or need eyeglasses or contact lenses, that eye exam is not covered, nor are the eyeglasses or contact lenses. However, if you get an infection in your eye or if you have an injury to your eye, the plan in most cases will cover the cost of the eye exam. The next one is about dental. Your plan does not include dental insurance, so services like cleanings, cavity fillings, extractions, root canals, or braces are not covered under the policy. The plan, however, provides a limited benefit called palliative dental, which is for emergency pain relief if you are having pain in your tooth, and it will cover up to $500 per school year. If you are a new student to the school and have a sickness or injury that you were diagnosed, have been treated for, or have been taking medication for within the last 3 months before your coverage started, this is considered to be a pre-existing condition, and the plan does not cover the cost of treatment during the first 6 months of your coverage. After 6 months, providing that your coverage remains continuous, the plan in most cases will start to cover the cost of treatment as long as the condition is a covered sickness or injury under the policy. If you skip a term without paying for the insurance coverage, you will need to resatisfy that 6-month waiting period when you re-enroll for the coverage the next time. Maternity or pregnancy is a covered benefit under the plan up to $25,000, as long as when you became pregnant happened after your coverage under the policy started. If you are pregnant now, the plan will not cover any treatment to the pregnancy, including delivery of the baby. What do you do if a doctor prescribes you medicine? In most cases, a doctor will give you a prescription that looks like this, and you can take it to any pharmacy of your choice. There's a Rite Aid, Walgreens, Fred Meyer. Any store with a pharmacy will accept your prescription. You do not need to provide or show them your insurance card. When picking up your prescription medicine, you will need to pay for the full cost of the medicine. Please be sure to keep the receipt and medication label, as you will be submitting a claim for reimbursement to the insurance company for 50% of the cost of the medication. This is the prescription benefit under the policy. So how do you file a prescription claim? On the back of your insurance card, we provide you the step-by-step instructions on how to do this. The first step is to go back to our website, and this time on the top right, you will click on My Coverage. Again, in the drop-down, click on your school's name. In the next screen, look for the medical/RX claim form and click on the View Print button. You will be directed to a PDF document of the claim form. You will need to fill this out with your information, including your mailing address. Please be sure that the address is current and complete, including any apartment or unit numbers. On a separate sheet, attach the receipt and medication label you received from the pharmacy. You have different ways of submitting your claim. You can mail it, fax it, or email it. Most students email it to our office, which is fine. If you choose to mail it directly to the company, please be sure to keep a copy of all the documents you are sending for your records, in case it gets lost in the mail, which can happen. After about 3 to 4 weeks, you will receive a check in the mail for 50% or half of what you paid for the medication. If you move or your address changes after you submitted your claim, please be sure to send us an email with your name and student ID number and let us know what your new address is so we can be sure to update it with the insurance company. So who do you call if you have any questions? Again, we are available to you 24 hours a day, 7 days a week, and our Washington and Oregon phone numbers, along with our email address, are on the insurance ID card, so please do not hesitate to contact us. I'd like to thank you for taking the time to watch this presentation. Enjoy your time at your school.